Do you have that pain in the crease of your hip like I do with running, sitting, and doing sit-ups? Well, it may not actually be your hip joint. It could be a strain of the rectus femoris muscle at the origin point as it attaches to the pelvis. This is a tendon that most people are not aware of, so I'm going to show you today how to find it, as well as talk about structure of what rehabilitation looks like to get you back into full activity. This next video is from an older video that we had on YouTube, which is very popular and helpful to a lot of people, but we're going to add to that and make it even better, so stay tuned for the whole video. Now, if you're dealing with problems into the groin area, lower abdominal region, or into the adductor muscles, you should watch this other video in the corner which covers those areas in more detail, because it can be a different type of condition.
You might feel it after a long run, it might progressively pop up after, a plane flight, something like that. Personally, I've had it myself, and I can tell you, at least from my experience, that it didn't even really hurt. It just feels like a nuisance. It feels like just an area of tightness. It just doesn't go away, and sometimes you feel it at night. You don't even want to go to sleep just because you're thinking about it so much, because it just feels like so much tension. On a road trip, we sat down, and I couldn't sit for probably more than a couple minutes period of time just because it felt like you need to stretch the area out. Okay, so palpating through this area, it's important to use bony landmarks as an area to figure out where you're at and which muscle is mainly the one affected. The muscle, again, that we're going to mainly be talking about is the rectus femoris origin point, which is right up in here. You can see that there's going to be a bony spot that you'll see them falling off into the abdominal cavity here. There's going to be a bony spot. This is called the ASIS, or the anterior superior iliac spine. If you sink just below it, there is the anterior inferior iliac spine, or AIIS, and that is the origin point of the rectus femoris, which travels all the way down to the kneecap. There's other muscles around the area. Just off to the side, there's the TFL, or tensor fascia lata. It also starts up just to the side of the ASIS, so sometimes people feel issues in here. So sometimes you can feel, if you have the person push, so you're going to push on me, and you can feel certain things pop up. So at this point, especially if she extends her knee a little bit more, you'll feel the rectus femoris pop up. Go ahead and relax. There's also the psoas, or the iliacus, that comes through in the inside part here, as well as some of the high adductors too. So figuring out the right area to treat is so important. So once you find the correct spot, if it's the musculotendinous junction, which a lot of times it is, there's the muscle comes up and it becomes a tendon, and right between, sometimes you'll ask and say, is that it? They'll say, yeah, that's it. What I like to do is something called active release. You basically find the area, so you sink to a certain depth, and then you're going to actively move the muscle past your contact point, which we're not doing really effectively right now, but this is a video, so it does not matter.
Now, truth be told, when I made that other video, I wholeheartedly believed that soft tissue care was the main thing that would get you to feel better and return to activity. I was wrong. 15 years into practice now, plus I've realized that people have reoccurrence of the same problem. And it's because we only did soft tissue parts, but we need to actually take workload off of those overused structures. It's not overuse because you've done too much mileage. It's overuse because you put excessive demand from poor function of other areas. So strengthening, stretching, restoring range of motion in other areas that are deficient is really important, but also this is specific to what you have going on. However, if you're interested in a lot of the exercises we use, we have a video in the corner that you can reference. But if these don't work for you, we have telehealth options, and we're licensed in different states, and we can give you the exact things that you would need to do to feel better faster. Our contact is below. Take care.